Welcome to NSG 217 Study Session 7. We're talking about oxygenation 1 and 2. Oxygenation or oxygen therapy is frequently used in the treatment of respiratory problems associated with hypoxemia. Oxygen is a colorless, odorless, tasteless gas that makes up 21% of atmosphere. This study session will discuss oxygenation 1 and 2, which includes the purpose of oxygen therapy, the indication of oxygen therapy, and the definition of some terms, the part of a cylinder, and the various methods of oxygen administration. Learning outcomes for study session 7. At the end of this session, you should be able to 1. Define oxygenation or oxygen therapy. 2. Define various terminologies. And 3. Identify the various methods of oxygen administration. Oxygenation. Oxygenation or oxygen therapy is the administration of oxygen at a concentration that increases the partial pressure of oxygen in inspired air. Why is oxygen therapy necessary? That is, purpose. The oxygen therapy is necessary because of the following. 1. To relieve dyspnea. 2. To maintain the partial pressure of oxygen. 3. To reduce the workload on the heart. 4. To administer low concentration of oxygen to patients. And 5. Lastly, to allow uninterrupted supply of oxygen during activities like eating and drinking. The clients who will need oxygen therapy, that is, indication: patient with pneumonia, patient who had severe hemorrhage, patient in shock, patient with severe anemia, patient who had cardiac failure, and patient climbing high altitudes. Definition of terminologies: Eupnea, that is normal respiration. Tachypnea, that is abnormally high respiration. Bradypnea, abnormal slow respiration. Apnea, a complete absence of respiration. Orthopnea, ability to breathe only in an upright position. Dyspnea, difficulty or labored breathing. Hypoxia, insufficient oxygen in the body. Hypercapnia or hypercarbia, that is accumulation of carbon dioxide in the blood. Cyanosis, a bluish tinge of skin color. The parts of an oxygen cylinder are as follows. Humidifier, that is a calibrated container filled with water to prevent administration of dry oxygen. Flow meter, a calibrated that states the liter of oxygen administered. Control valve stroke regulator. These act as the on and off knob for administering oxygen. The gauge states the amount of oxygen in the cylinder. Various methods of oxygen administration. The various methods of oxygen administration are as follows. Number 1, nasal cannula or catheter or nasal prongs. Number 2, face mask, which includes simple face masks, partial and non-breathing mask, and ventricular mask. Number 3, oxygen tent. Number 4, oxygen hood. Number 5, oxygen conserving cannula. Number 6, oxygen panel. Number 7, oxygen concentrator. Number 8, tracheostomy collar. And number 9, tracheostomy T-bar. The various methods of oxygen therapy can be classified into low-flow delivery devices and high-flow delivery devices, which is shown in the diagram below. Nasal cannula. This is the method by which oxygen is administered in low concentration through a cannula, which is a disposable device with two protruding prongs for insertion into the nostril. Below is an image example of nasal cannula. Purposes: to relieve dyspnea, to administer low concentration of oxygen, to allow uninterrupted supply of oxygen during activities like eating, drinking, etc. Articles needed: number 1, oxygen source; number 2, nasal cannula with connecting tubes; number 3, humidifier with distilled water; number 4, flow meter; number 5, gauze pads; and number 6, no smoking sign. Special precautions. Number 1, never deliver more than 2 to 3 liters of oxygen to patients with chronic lung disease, that is, chronic obstructive disease. Number 2, check frequently that both prongs are in patient nurse. That is, oxygen concentration will vary on many factors like patient tidal volume and ventilatory pattern. Purpose: to relieve dyspnea, to administer higher concentration of oxygen. Articles: oxygen source, mask, which is simple or with Ventura adapter high flow device of appropriate size. Number 3, humidifier with distilled water. Number 4, flow meter. Number 5, gauze pieces. And number 6, no smoking sign. B, oxygen conserving cannula. Oxygen conserving devices include transtracheal catheters, reservoir cannula, and demand oxygen delivery system. They are designed to extend the amount of time portable oxygen cylinders will last and correct hypoxemia with a lower flow of oxygen, which is shown in the picture below. C, oxygen panel. Oxygen control panel allow patients' oxygen level to be adjusted from the control room and eliminates the need to intrude into the patient room to adjust the oxygen flow rate, possibly disturbing the patient's sleep, which is shown in the diagram below. D, oxygen concentrator. An oxygen concentrator is a medical device used to deliver oxygen to those who require it, which is shown in the picture below. E, tracheostomy T-bar. Tracheostomy tubes are used to administer positive pressure ventilation to provide a patient air and are important for clinicians caring for patients with tracheostomy, which is shown in the picture below. F, tracheostomy collar, which is shown in the diagram below. Summary of study session 7. In this study session, you've learned that 1. Oxygenation is the process of treating patients with oxygen. Oxygen therapy is vital because it helps to relieve dyspnea, reduce workload from patients' heart, and to allow uninterrupted supply of oxygen. Number 2, patients that need oxygen are people that suffered cardiac failure, pneumonia, shock, and severe anemia. Number 3, the parts of oxygen cylinder are as follows: humidifier, that is the calibrated container filled with water to prevent administration of dry oxygen. Flow meter, a calibrated that states the liter of oxygen administered. Control valve stroke regulator acts as the on and off knob for administering oxygen. Gauge states the amount of oxygen in the cylinder. Number 4, the various method of oxygen administration is listed and explained above. Thank you. We've come to the end of this study session.